I am Dr. Mark Lee. Welcome to our channel. Every morning before your first bite, your blood sugar story has already begun. Today, you'll learn a simple drink that may help slow glucose spikes, calm cravings, and support pre-diabetes reversal when used correctly. But the real secret is not the drink. It is what the drink does next, inside your gut, liver, muscles, and morning hormones. Stay with me because mistake number 3 changes everything for people over 50 today. Most people with prediabetes are told the same 3 sentences: lose weight, eat better, walk more. And let me be clear, those things can help. But for someone over 50, especially someone over 60, that advice can feel like being handed a map with half the roads missing. Because prediabetes is not just about eating too much sugar. It is not just about lacking discipline. And it is definitely not just about getting older. Prediabetes is often the result of a body that has been quietly struggling for years to handle glucose, insulin, stress, sleep, belly fat, lost muscle, and the wrong morning routine. And here is the shocking part. For many people, the first blood sugar mistake of the day happens before breakfast even begins. Your liver releases glucose while you sleep. Your cortisol rises to wake you up. Your muscles are either ready to accept glucose or they are resistant. Then breakfast arrives. And within 90 minutes, your body either stays steady or it starts the roller coaster. Energy up, energy down. Hunger back, cravings stronger, brain fog creeping in. And by the time your doctor checks your A1C 3 months later, that roller coaster has already repeated hundreds of times. A1C is a blood test that gives a rough picture of your average blood sugar over about 3 months. Fasting glucose is the sugar level in your blood after not eating overnight. Both matter. But they do not show you the full story of what happens after meals. That hidden after-meal spike is where many people get blindsided. Now, when I say drink this every morning and prediabetes starts reversing itself, I do not mean a miracle cure. I do not mean one glass can undo years of insulin resistance. That would be wrong. What I mean is more practical and much more powerful. There is a simple morning drink that may help create a break before breakfast. A break on how quickly glucose enters the bloodstream. A break on the sharp spike that exhausts the pancreas. A break on the hunger crash that makes you think you have no willpower. And wait for it, the drink is not the whole solution. The drink is the door. What you do in the next 30 minutes decides whether that door opens into progress or disappointment. Let me introduce you to someone. I will call her Margaret. Margaret was 68, retired, organized, careful, and frankly frustrated. She was not eating candy bars for breakfast. She was not drinking soda all day. She was not careless with her health. Every morning, she had what she believed was a sensible meal. Whole wheat toast, orange juice, a banana, coffee. It looked harmless. It looked healthy. It looked like the kind of breakfast many people over 50 were told to eat for decades. But by 10:30 every morning, Margaret felt shaky, then tired, then foggy. She would read the same message twice and still not remember what it said. She would open the refrigerator and forget why she was standing there. Then came the craving. Something crunchy, something sweet, something quick. Her fasting glucose rose from 112 to 118 to 123. Her A1C moved from 5.8 to 6.1, then 6.3. Her doctor told her, "You are very close to diabetes." Margaret said the sentence I hear all the time, "But I barely eat sugar." Remember that sentence because we are coming back to it. The truth is, Margaret's problem was not only sugar. It was speed. Her breakfast turned into glucose quickly. The toast broke down fast. The juice required almost no digestion. The banana added more carbohydrate. And because the meal had little protein, little fat, and almost no viscous fiber, the glucose entered her bloodstream fast. Her pancreas responded by releasing insulin. Insulin is the hormone that helps move glucose from your blood into your cells. When your cells respond well, insulin works quietly. But when your cells are resistant, your pancreas has to push harder, then harder again. At first, the body compensates. Blood sugar may look only a little high, but behind the scenes, insulin is working overtime. That is insulin resistance. Your body is making insulin, but the cells are not listening the way they should. And when breakfast hits too fast, the system gets overwhelmed. Blood sugar rises sharply. Insulin rises sharply. Then blood sugar can drop quickly. And that drop can feel like anxiety, hunger, weakness, irritability, or a sudden need for food. Margaret thought she lacked discipline. She did not lack discipline. She lacked a break. That is what this morning drink is. A break. Not a cure, a break. Now here are the 3 secrets of the drink. Secret number 1 is hydration. Secret number 2 is soluble fiber. Secret number 3 is timing. And the timing is the part most people miss. The base is 8 to 12 ounces of water. Simple, almost too simple. But after a long night, many older adults wake up mildly dehydrated. Not dangerously dehydrated, just dry enough that digestion is slower, constipation is worse, blood volume is slightly lower, and the body feels more stressed than it needs to. After 50, thirst signals can become less reliable. You may not feel thirsty until you are already behind. So water matters. Not because warm water melts belly fat. It does not. Not because cold water shocks your metabolism into burning sugar. That is internet theater. Water matters because the body handles glucose better when it is not starting the day under unnecessary strain. But water alone is not the secret. The most important ingredient is psyllium husk. Start with 1 teaspoon, not one giant scoop, not a heaping tablespoon because someone online promised faster results. 1 teaspoon. Psyllium is a soluble gel-forming fiber. When it mixes with water, it thickens. It forms a soft gel, and that gel changes the speed of digestion. It can slow stomach emptying. It can slow carbohydrate absorption. It can reduce the sharpness of the glucose rise after a meal. Think of it like putting a traffic officer at the entrance to your bloodstream. Without that officer, glucose rushes in all at once. With soluble fiber, the traffic moves more gradually. Same road, different speed. And speed matters. Because your pancreas does not panic when glucose arrives slowly. Insulin does not have to shout as loudly. Your energy does not rise and crash as violently. Your hunger signals become calmer. And for many people, that means fewer cravings later in the day. This is why beans, lentils, oats, vegetables, chia seeds, and berries can be so helpful for metabolic health. They do not perform magic. They slow the system down. They make food behave. But here's the pattern interrupt. Psyllium can also cause problems if you use it carelessly. You must mix it with enough water. You must drink it promptly before it becomes too thick. And you should follow it with a few more sips of plain water. If you have swallowing problems, bowel narrowing, severe constipation, or difficulty drinking fluids, ask your healthcare professional before using it. And if you take morning medications, this matters. Psyllium can interfere with absorption, thyroid medicine, heart medicine, diabetes medicine, antidepressants, supplements. Do not casually swallow them all together with fiber. A common safety approach is to separate psyllium from medications by at least 2 hours, unless your clinician tells you otherwise. That one detail may be the difference between a helpful habit and a mistake. Now comes the optional ingredient everyone argues about. Apple cider vinegar. 1 to 2 teaspoons diluted in the water. Not straight. Never straight. Not a shot glass. Not 2 tablespoons on day 1 because a stranger on the internet called it a cure. Vinegar contains acetic acid. In some people, acetic acid may help reduce the blood sugar rise after a carbohydrate-containing meal. It may slow starch digestion. It may slightly improve how muscles handle glucose. But listen carefully. The effect is modest. Helpful for some, not tolerated by others. And not a replacement for food changes, movement, sleep, weight management when appropriate, or medication when needed. But here is the shocking part. For the person eating a fast breakfast, even a modest reduction in the spike can matter. Not because vinegar is powerful like a drug, because breakfast happens every day. A small improvement repeated hundreds of times can become meaningful. But vinegar is not safe for everyone. If you have reflux, ulcers, gastroparesis, chronic kidney disease, low potassium, swallowing trouble, or you take diuretics, insulin, sulfonylureas, or certain heart medications, ask first. Vinegar can irritate the throat. It can worsen heartburn. It can affect teeth, so dilute it well. Use a straw if you drink it often. Rinse your mouth with plain water afterward, and do not brush your teeth immediately after. Give your enamel time. Now the optional flavor ingredient is cinnamon, a small pinch. Not a tablespoon, not 4 capsules, just a pinch. Some studies suggest cinnamon may modestly help glucose patterns in people with insulin resistance, but results are mixed, so we do not pretend it is proven medicine. Cinnamon is a possible nudge, not a treatment. And common cassia cinnamon contains coumarin, which can be a concern in large amounts, especially for the liver or for people on blood thinners, so no megadosing. The body does not reward extremes. Here is the drink: 8 to 12 ounces of water, 1 teaspoon psyllium husk, 1 to 2 teaspoons apple cider vinegar if tolerated, a small pinch of cinnamon if desired. Stir quickly. Drink 10 to 15 minutes before breakfast. Then, drink a few sips of plain water. That is the recipe. But remember when I said the drink is not the whole solution? Here is where most people ruin it. They drink the fiber water, then eat the same fast breakfast that caused the problem. Sweet cereal, toast alone, orange juice, a banana by itself. Flavored coffee. A muffin that is basically cake wearing a breakfast costume. Then they say, it did not work. Of course it did not work well. You put a brake on the car, then drove downhill with your foot on the gas. The drink prepares the body. Breakfast decides the outcome. This is where Margaret changed. She stopped drinking orange juice in the morning. That one change shocked her. Because fruit juice looks healthy. It came from fruit. It has vitamins. It feels responsible. But to a body struggling with prediabetes, orange juice can behave like a fast liquid sugar load. An orange is food. Orange juice is a glucose delivery system with some vitamins attached. That sounds harsh, but if your A1C is rising, you need the truth more than comfort. Margaret replaced juice with water or unsweetened tea. Then she rebuilt breakfast using a simple rule. Protein first, fiber second, carbs last. Protein first could be eggs, Greek yogurt, cottage cheese, tofu, fish, chicken, or a protein-rich smoothie without added sugar. Fiber second could be berries, chia seeds, vegetables, beans, lentils, or oats. Carbs last means if you eat toast, oatmeal, or fruit, do not eat it alone. Carbs eaten alone move fast. I call them naked carbs. Toast by itself, crackers by themselves, cereal by itself, a banana by itself. They may not be forbidden, but they need clothing. Protein, fat, fiber. That is the clothing. And wait for it, Margaret did one more thing that may have helped as much as the drink. She walked for 10 minutes after breakfast. Not an hour, not a punishment march. 10 minutes. Sometimes around the block, sometimes inside the house, sometimes holding the kitchen counter and marching gently in place. Because after a meal, muscles can act like a glucose sponge. Movement tells muscle cells to open their doors. When muscle cells open, glucose can leave the blood more efficiently. This is especially important after 60 because aging often brings muscle loss. And muscle is one of the largest places your body stores glucose. Less muscle means less storage space. Less storage space means glucose stays in the blood longer. That is why prediabetes after 50 is not just a sugar problem. It is a muscle problem, a liver problem, a sleep problem, a stress problem, a breakfast problem, and yes, a routine problem. Now let us talk about the word that gets clicks and causes confusion: reverse. Can prediabetes reverse? For many people, yes, blood sugar can return to the normal range. A1C can improve, fasting glucose can come down, insulin resistance can improve, the risk of type 2 diabetes can be reduced. But reversal does not mean you are permanently cured and can ignore the habits that got you there. It means the pattern has moved in a healthier direction. If the old pattern returns, the numbers can return too. That is not failure, that is biology. Prediabetes is a warning light on the dashboard. You can cover it with tape and keep driving, or you can use it as early information. And early information is powerful. Because at the prediabetes stage, many people still have time. Time to reduce visceral fat. Visceral fat is the deeper belly fat around the organs. It is not just stored energy, it is metabolically active. It can release inflammatory signals and worsen insulin resistance. Inflammation is part of the immune response, but when it stays chronically elevated, it can interfere with normal metabolic function. You also have time to rebuild muscle, time to improve sleep, time to reduce after-meal spikes, time to protect the eyes, nerves, kidneys, heart, and brain before the damage becomes harder to reverse. That is the opportunity hidden inside the warning. Now here is mistake number 1, skipping breakfast and calling it discipline. Some people do fine with a shorter eating window. Others, especially older adults, feel worse. They wake up, drink coffee, ignore hunger, push through weakness, then eat too fast later. By evening, cravings are louder, sleep gets worse. The next morning, fasting glucose is still high. Why? Because your liver was busy. Your liver stores and releases glucose. Overnight, it can release glucose to keep you alive and functioning. But when insulin resistance is present, the liver may release more than you need. That is one reason someone can wake up with high fasting glucose even though they did not eat during the night. They say, "How can my sugar be high? I was sleeping." Because your liver was not sleeping. Your hormones were not sleeping. Cortisol was rising. Cortisol is a stress hormone that helps wake you up. But when stress is chronic or sleep is poor, cortisol can push glucose higher. So the morning routine is not just about food. It is about sending the body a signal. The drink says, slow down. Protein says, stabilize. Fiber says, release gradually. Movement says, move glucose into muscle. Sleep says, reset. The body listens to repeated signals, not speeches, signals. Mistake number 2 is trusting healthy labels. Whole grain, natural, no added sugar, low fat, heart healthy. Those words may sound reassuring, but your blood sugar does not read labels. It responds to digestion. A bowl of cereal can have a healthy-looking box and still spike you. A granola bar can look wholesome and still behave like dessert. A fruit smoothie can contain more fast carbohydrate than you expected. This is why glucose response is personal. One person may handle oatmeal well. Another person may spike sharply unless they add protein and fat. One person may handle a small apple. Another may do better with berries. The goal is not fear. The goal is feedback. If you monitor glucose, check what happens 1 to 2 hours after breakfast. If you do not monitor, watch your body. Do you crash? Do you crave? Do you get sleepy? Do you feel foggy? Do you need more food soon after? Your body leaves clues. Mistake number 3 is the one I told you changes everything. People try to lower blood sugar by eating less, but they forget to protect muscle. After 50, muscle loss can accelerate. After 60, it can become one of the biggest hidden drivers of metabolic decline. You may weigh the same, but have less muscle and more fat. You may even look thinner and still have worse glucose control. This is why aggressive dieting can backfire. You lose weight, but some of it is muscle. Then your glucose storage capacity shrinks. Then maintaining improvement becomes harder. The shocking truth is that muscle is not just for strength. Muscle is medicine-like tissue. It stores glucose. It improves insulin sensitivity. It helps balance metabolism. It protects mobility. It protects independence. So yes, walk after meals. But also, build strength 2 or 3 times a week if you can do so safely. Wall push-ups, chair squats, resistance bands, light dumbbells, sit-to-stand practice, guided physical therapy if needed. You are not training for a bodybuilding contest. You are building glucose storage. You are building stability. You are building your future independence. Now let us return to Margaret. She used the drink before breakfast. She changed juice to water. She stopped eating toast by itself. She added protein. She walked for 10 minutes after breakfast. She did not become perfect. She still had birthdays. She still had family dinners. She still had days when her knees hurt and she could not walk much. But after 2 weeks, something changed. Her 10:30 crash softened. Her cravings were quieter. Her afternoon fog was less intense. After 3 months, her fasting glucose was no longer climbing. After 6 months, her A1C had moved down. Not because one drink cured her, because one drink became the anchor for a better morning. And that is the point. The drink is the anchor, not the whole boat. Now, some of you are thinking, what if I already take metformin? Then this still matters. Metformin may be helpful for some people at higher risk, but medication does not replace daily signals from meals, movement, sleep, and muscle. Lifestyle does not mean medication failed. Medication does not mean lifestyle is pointless. Sometimes the strongest plan is both, guided by your clinician. Some of you are thinking, what if I am thin? You can still have prediabetes. Prediabetes is not only a weight problem. It can involve genetics, fatty liver, poor sleep, stress, low muscle mass, medications, menopause changes, and aging-related insulin resistance. You can be thin outside and metabolically strained inside. That is why the goal is not simply a smaller body. The goal is a more responsive body. A body that handles glucose with less panic. A body with stronger muscles, better sleep, steadier meals, and fewer spikes. Now, before you try this drink tomorrow, listen to the safety list. If you have swallowing problems, bowel narrowing, severe constipation, kidney disease, heart failure with fluid restrictions, gastroparesis, ulcers, significant reflux, low potassium, or you take blood thinners, insulin, sulfonylureas, diuretics, or important morning medication, talk to your clinician first. Natural does not mean automatically safe. A snake is natural. Poison ivy is natural. The question is not whether something is natural. The question is whether it fits your body. And do not stop prescribed medication because of a YouTube video. Do not replace medical care with vinegar, cinnamon, or fiber. Use this as a conversation starter and a habit to discuss, especially if you have complex health conditions. Now here is your 7-day morning challenge. Day 1, make the drink small and simple. Water and 1 teaspoon psyllium. Only add vinegar if you tolerate it. Only add cinnamon if it is safe for you. Day 2, remove fruit juice from breakfast. Day 3, add protein first. Day 4, dress your carbs with fiber, fat, or protein. Day 5, walk or move for 10 minutes after breakfast. Day 6, notice your cravings, energy, and hunger. Day 7, write down what changed. Not perfection, data. Because when you collect data, you stop guessing. And when you stop guessing, you stop blaming yourself. If you track glucose, compare your breakfast response. If you do not track glucose, compare your morning energy. How soon were you hungry? Did the fog appear? Did cravings hit? Did you feel calmer? Those answers matter. A1C takes longer to change because it reflects a longer pattern. Think of A1C like smoke staining on a wall. One clean day does not repaint the room, but enough clean days can change what the wall looks like. That is how reversal often begins, quietly, repeatedly, without drama. Now I want you to write down 3 numbers before your next appointment. Your fasting glucose, your A1C, your waist measurement. Not to obsess, to establish a baseline. Fasting glucose tells part of the morning story. A1C tells part of the 3-month story. Waist measurement gives a clue about visceral fat. Then ask your clinician what target is safe for me, because a strong 62-year-old and a frail 84-year-old should not always follow the same plan. Older adults need personalization. Kidney disease matters. Medications matter. Fall risk matters. Appetite matters. Muscle loss matters. This is where generic advice can become dangerous. Eat less is not always the right answer. Often, the better answer is eat smarter. More protein, more fiber, fewer liquid sugars, better meal order, more movement after meals, more strength, better sleep, less late-night grazing, and a morning routine that makes breakfast gentler on your glucose system. So tomorrow morning, do not try to change your entire life. Start with the break. 8 to 12 ounces of water, 1 teaspoon psyllium, optional vinegar diluted, optional cinnamon, small pinch, 10 to 15 minutes before breakfast. Then build a breakfast your pancreas does not have to fight. Protein first, fiber second, carbs last. Then move your body for a few minutes after eating. 2 minutes if that is where you are, 10 minutes if you can. More later if your body allows. Because the most dangerous part of prediabetes is not the number on the lab report. It is the belief that the number is permanent. It may not be. Your body is still listening. Your liver is listening. Your muscles are listening. Your pancreas is listening. Your future is listening. If this helped you, write the word morning in the comments so other people know they are not alone in trying to change that first hour of the day. Share this with someone who says, "My sugar is only a little high." A little high is exactly when action matters most. Subscribe for clear, careful guidance on blood sugar after 50, without fear tactics and without miracle claims. And in the next video, we need to talk about the breakfast mistake that keeps fasting glucose high even when you stop eating sugar. Because for many people, the problem is not the dessert they feel guilty about. It is the healthy breakfast they trusted for 20 years. Tomorrow morning, give your body a better signal. Not a perfect signal, a better one. And better, repeated long enough, is where reversal begins.